significant personality and the stakeholders and the stalwart of the area. And first, I would like to welcome our chief guest, Padma Shri Professor B.N. Gangadhar sir, who is the man of chair on the National Medical Commission. And sir has might to introduce and ensure the standard of psychotherapy training across the country. So welcome you, sir.
Thank you, sir. Thank you very much. Best of luck.
So I would like to welcome our guest of honor, Professor Dr. Pratima Murthy, who is the director of NIMHANS, Bangalore. And madam is very enthusiastic about the all psychiatry related training program and always be a supporting pillar for all the psychiatry related training programs. So welcome you, ma'am.
Thank you.
We have next guest of honor, Professor Dr. Savita Malhotra, who is the president of Indian Psychiatry Society. Madam is ex-dean and the head of the Department of Psychiatry, PGI Chandigarh. And madam, we know ma'am has a long career of, as an academician and the researchers and the educationalist. Madam is multi-talented. Madam has a vocalist. Madam is vocalist and madam is also a poet. And madam is a great leader. And we know that madam belongs to the institution where the psychotherapy training is there for in a very structured and a very meticulous form. So it's it's a privilege to have ma'am. Welcome you, ma'am.
Thank you very much.
Hello, Savita ji.
Hello, Dr. Gangadhar.
Namaste.
Namaste ji. Namaste.
I also welcome one of the very primary supporting pillar of psychiatry training, not only in India, but also in across the globe. Professor Mohan Isaac. Whether sir is there? Professor Mohan Isaac, sir. Okay, I'll tell that sir has played a very crucial role in, shaping the foundation of this current program because he's inspired to, conduct the nationwide survey and which would become the background of the current program. So welcome you, sir.
Thank you. Thank you very much.
Namaste, sir.
I extend my warm welcome to the Professor Emeritus Dr. T.S.S. Rao, sir, Vice President, Indian Psychiatry Society. Welcome you, sir.
Thank you.
I welcome Professor Mathew Varghese, who has a long experience in the psychotherapy and family psychotherapy, and who is also a speaker of our monthly psychotherapy discussion program online. And so welcome you, sir, Professor Mathew Varghese. I welcome Dr. Amrit Pattojoshi, Honorable General Secretary, Indian Psychiatry Society. Dr. Sujit Sarkhel, Editor, Indian Journal of Psychiatry. I welcome Dr. Aleem Siddiqui, Honorable Treasurer, Indian Psychiatry Society. I should not forget the welcome of Dr. Avinash Priyaranjan, who is representing the Undergraduate Psychiatry Training Subcommittee. He has been selected as a chairperson of the UG subcommittee. And in the last but not the least, Dr. Kishor M., who is the link between all the bringing all the like-minded people together to execute and materialize this program. So welcome you, sir.
Thank you, Ajay.
I welcome Dr. Kiran, Dr. Vinay, who was very active and playing a key role to execute this program. And I welcome all the audience. So with that welcome note, I will hand over mic to Dr. Kishor so that he can introduce the sketch work of the program. Thank you.
Respected dignitaries, it's a privilege to be on this platform, and we all understand that psychotherapy training is at the foundation of psychiatry services. When we review the literature from Professor Verma to Ajay's work on is there a need for psychotherapy training, there has been phenomenal evidence that there is definite need of psychotherapy training. And when we did the survey also, we found out there is a lot of gap in terms of providing psychotherapy training at the undergraduate and postgraduate level. very interestingly, we found out that there is a lot of difficulty to have access to the training, probably because of lack of training to those people who have taken up faculty position across India. Now, when we circulated the survey and we wanted to know about psychiatry postgraduates and faculty, in what way they would like to have training in psychotherapy, we had an overwhelming response, and Ajay will sometime present that survey. More than 500 postgraduates and faculty across India said they need a platform where they can get their training in psychotherapy. And in this background, when we discussed with many people at the National Conference of Psychiatry Teaching Learning at Bangalore, there was overwhelming need that we should have some kind of platform where some discussion happens about psychotherapy. And it is this background we thought about raising this issue with the Indian Psychiatry Society, as well as the when we discussed with Pratima Murthy Madam, and the UG and PG committee which were formed in this year. So it's important that on this occasion, all the dignitaries who make psychiatry training in India possible are in one place. It's not about the numbers, it is about those people who will play a key role. And when we started to work on the online mode, Professor Mathew Varghese, who was the professor, who was the earlier professor at NIMHANS and adjunct faculty at St. John's currently, he came forward that he will facilitate the training. So we had trial of 3 training sessions so far, and it has been scheduled on Tuesdays, 2nd and 4th Tuesdays of every month. And then we are planning on offline mode where we can enhance such kind of services to the psychiatry postgraduates and faculty wherever there is need. And it is in this background we wanted the dignitaries to come on this platform and put their views about what is that they think should happen. I, on behalf of IPS PG Education Subcommittee as a chairperson, and my team is here, and Dr. Priyaranjan Avinash, who is the chairperson of IPS UG Education Subcommittee, and his team is here. We are going to listen keenly to everyone's view and see where we can start. But I would request all of you to please play a key role to help us and guide on how we can take this platform forward. With this, I would hand over to Dr. Ajay to carry forward this session. Over to you, Ajay.
Now we would like to have Professor B.N. Gangadhar sir, so that he can share and proceed for the inauguration of this program.
Thank you. At the outset, let me congratulate the entire team for conceiving this idea and making it actually fructified in the way of this video conference inaugural meeting, and also continue the issue henceforth on a digital platform. So I wish the team all the best, and I'm sure in the days to come, this will unfold into a big movement, and also more and more psychotherapy enthusiasts will get into this activity. I have a few observations on this matter. I'm not sure in all our psychotherapeutic exercises, which we have been learning from books, the cultural angle has been emphasized, and the cultural issues are included into our psychotherapeutic framework. Maybe yes, may not be also, but that is one emphasis that I am placing. Second issue is, you can see psychotherapy as a very individualized program, which it has to be, But then there is also a skeleton which is perhaps uniform to all. The coverings of a skeleton can change, but by and large, a skeleton of the psychotherapy can be now conceived by this group, on which people can build different programs to make sure that it suits the given individual, and of course the condition with which the given individual has come for help. The reason why I am saying that a common skeleton should be adopted for psychotherapy as a program is as follows. I'm not sure if today any of the insurance groups cover psychotherapy. If something is going on, I would like to be enlightened on this matter. Maybe I'll reframe my thoughts. But psychotherapy to be covered by insurance, again, we'll ask several questions. Amongst them, how uniform it is across the entire country or entire professional group. This is it. So in this context, I know that we all may not agree on a uniform psychotherapy module. We could vary both by way of our expertise and also by way of the needs of the patients. And of course, on some situations where we may choose one or other psychotherapy depending upon our interests. Interests, expertise, and the patient's situation govern each therapeutic module. But the underlying skeleton could be the same, for which we can demand that this is followed in all psychotherapy programs. And for this, 2, 3, 4 sessions would be required, and for which a fee of X has to be reimbursed. And if this is something that we can sell with evidence base, maybe other inputs which are equally important but could be varying across therapy sessions, therapy patients, therapy clinicians, could be different, but at least the skeleton should be reimbursable by insurance agencies. If this group can come up with such a formula, that will be very helpful and would encourage many therapists to take it up. And at some point of time, we will be able to have a standardized schedule of psychotherapy across people. So I will perhaps stop here, and I know there are many other stalwarts in this group who may be willing to contribute. I also would like to hear them, being not a psychiatrist who is primarily engaged in psychotherapy as a practice procedure in my clinics. I will probably, with all humility, refrain from making any more comments. But as an administrator in NMC, I see there is a need for regulation with respect to at least getting some insurance coverage for psychotherapy. Think about it and see if we can get this possible. And because of my personal interest in cultural aspects, see if that dimension is incorporated in all the psychotherapeutic modules that we probably put into practice. Wish you all the very best. And I know in 2 days down the line, we also enter into a new year. Wish all the people a happy new year. Thank you so much.
Thank you, sir. Thank you, sir, for emphasizing the coverage of psychotherapy and under the insurance. Next, we have our guest of honor, Professor Dr. Pratima Murthy, and I would invite ma'am to share their opinion and suggestions for the program.
Thank you, Dr. Ajay. Very good evening to everyone here. I'm not going to take individual names. I see a lot of my teachers. I see a lot of the office bearers of the Indian Psychiatric Society at the national level as well as in Karnataka. First, let me say a hearty congratulations for actually having taken up this very important task, which perhaps in some ways hasn't been given the attention that it deserves. At NIMHANS, possibly ever since I was on the faculty, I've been involved in the psychotherapy programs. And that's something perhaps which is not just something that you give to trainees in psychiatry, but it's been a very mutually enhancing and learning process for all of us who've participated in psychotherapy programs. I know you did mention that Dr. Mathew Varghese is also here today, and he's one of the who was one of the people who's very active in the psychotherapy programs. So what we would do is we would have a set of students who kind of join the MD or the DPM program, and they would be assigned to a psychotherapy supervisor. And through their 3 years, once a week, which is roughly the kind of schedule that you have planned online. Of course, we did not have opportunities to do it online. It was always in person. We would meet with these students. One of the first things that we would teach them are good communication skills. And I think those good communication skills are very handy for all psychiatrists in being able to engage patients and being able to do a good follow-up with patients. And these are also very important for any health practitioner, any medical practitioner who wishes to see patients in the long run. So these were extremely useful. And I think they are skills that people have kind of really sharpened over the years. The second thing, of course, is encouraging students to bring in cases that they saw in the outpatient who required some form of psychotherapeutic intervention. And it was through the eyes of the trainee and, of course, the discussions of the trainee that we would take on the group, the entire group. So when I say we, it was not just the psychotherapy supervisors, but the other participants in the group who would also contribute to try and understand the underlying conflicts, how to help the patient. It was not important what school of psychotherapy was followed, whether a person was more psychodynamically inclined or more cognitive behaviorally inclined or more humanistically inclined. There are certain common elements of psychotherapy which can easily be looked at in terms of understanding the person's conflicts, the current situations, ways of being supportive to the patient. All of us know that there are general principles of psychotherapy which actually make people get better. And then, of course, there are the specific kind of skills that you can borrow from different schools of psychotherapy to be able to help the person along. So the most important things that were done were supportive forms of psychotherapy, keeping patients, optimistic, helping them ways of learning to solve problems and of going forward. So I'm presuming that, and I do know that several colleagues later have also participated in balanced groups and, taken the advantage of some of those learnings as well. So I believe that what will be actually learned are the general skills of psychotherapy rather than a particular school of psychotherapy, number one. Second things is that I hope there will be case presentations, because it's really around case presentations that people learn how to make a psychotherapeutic formulation, what are the areas to help the patient in, what are the phases in which the help is done, how do you actually make a contract with the patient to attend a certain number of sessions, review what has occurred in those sessions, and then how do you plan it further. So there are many of these things. I would call it the science of psychotherapy as well as the art of psychotherapy that can be learned. Dr. Gangadhar was raising an important question about payment. Now, there was a committee which recommended in terms of insurance. Right now, insurance coverage is only for inpatient. Therefore, the first step was to actually recommend that insurance also covered outpatient treatment, because a large proportion of our patients have a benefit from outpatient treatments, and within that outpatient also for psychotherapeutic session. But I think what he has said is also important in that we know how to structure these sessions, from the time duration, the convenience, the issues of confidentiality. How do you deal with it when other family members also want to know what is happening within the psychotherapeutic sessions? How do you start a particular session of psychotherapy? How do you close it? How do you respond to any kind of conflicts that may arise because of the nature of the relationship with the client? What are the do's and don'ts? I think a lot of these can be reasonably structured, but within that also one needs to learn the further skills. So I think if this program can teach communication skills, generally case-based approaches to understanding how one progresses in therapy, what one does, how one responds. The fact is that you don't really solve problems directly for patients usually. You teach them ways of problem solving so that they'd be able to do it in future. Of course, one believes that the eclectic form of psychotherapy, which Dr. Shamsundar is very fond of, I think we owe it to Dr. Shamsundar, who really told us that it's good to have an eclectic form, and that is after you know the basic approaches in different kinds of psychotherapeutic schools, and then to really take some of the simple elements of all of these and to combine them is very critical. Obviously, this means a certain amount of flexibility and adaptation based on what the patient's problems present. And therefore, these become important things to learn. And I'm sure many of these things will be touched upon. I see at the end, one, that clinicians, and I must tell you this, my own experience from supervising psychotherapy, young students who came completely biologically oriented at the end of the psychotherapy supervision, most of them, I think practically everybody said that they understood the importance of actually engaging with patients, giving them certain help in terms of understanding their own self psychologically and moving on. So I think that is a very, very important thing, that it can be combined. We also obviously take into consideration all the cultural nuances, and therefore a very personalized kind of approach, in addition to learning the general principles of psychotherapy, also become important. And over time, I think people get the confidence. I think one thing that a lot of psychiatrists lack is the confidence that they will be able to carry out psychotherapy. And therefore, it's not enough to learn it from books. You have to learn it from actually seeing, doing, unlearning some of the things that we know, and learning some of the common principles. So I'm sure it's going to be a great journey. I certainly have enjoyed all my psychotherapy training. By the way, I was also a trainee in psychotherapy, and Dr. Shobha Srinath was my supervisor. And I think there's a lot that we learned at that time. It was also very important. The groups also brought us together. And I'm sure even though the groups will be online, it's a wonderful peer group that we will develop where we can continue to discuss, issues that we have. Of course, making sure that we respect confidentiality of patients and making sure that we are doing this in the interest of patients. So all the very best. I'm sure it will be a great learning journey for everyone. I wish I could have participated in every one of these training sessions, because I think it's a wonderful growing up that one experiences. But I'm sure some of the things will rub off onto us vicariously. One who's both organizing this and participating in this. Here, there are no teachers and learners. I think we all learn from each other. So it's a very democratic playing field. And I want to congratulate, I guess it's the ITOPS initial ITOPS training that has now expanded into the psychotherapy training. So Dr. Kishor, the mentorship of Dr. Mohan Isaac, all the other colleagues, Vinay, all the other, I'm not taking individual names, but all the colleagues who've been involved in this, hearty congratulations and all the very best. Thank you very much.
Thank you, madam. Um, uh, Now we have Dr. Savita Malhotra. Ma'am, I would like to invite Dr. Savita Malhotra to say a few words and suggestions that how this online training program can be structured, although we have some offline training plans also. So please, ma'am.
Thank you very much. Thank you very, very much. And all my colleagues out here on the Zoom platform that I'm in communication with at the moment, my greetings to all of you. It's a very important occasion and very, very important task that the committee, PG and UG task force and committees of IPS have initiated. And congratulations, heartiest congratulations to Dr. Kishor, Dr. Ajay, and with all the mentors, Dr. Mohan Isaac and all their team members, Priyaranjan, Avinash, and everyone, for taking it up
मैं
for.
अटेंड कर लिया इसलिए जाके क्लब करके बोलना पड़ेगा.
Can you? Okay. And see, this, I will not emphasize on the need for psychotherapy training. There is no question and no doubt that psychotherapy is an equal part in our therapeutic armamentarium for treatment of mental disorders. Mental illnesses, although we have very, very powerful drugs, although our biological sciences have advanced with leaps and bounds in the recent years, but nevertheless, there will never be a day that just on the basis of medication or biological interventions, mental illnesses will be treatable. Mental illnesses arise from not just the biological disturbance in the brain, but also are constantly and continuously influenced, maneuvered by the environmental experiences of life. So which will never diminish and will always require intervention to deal with mental illnesses. So there is no question that psychotherapy is the future, that whether we will need or we will not need. That's number one. Number two, psychotherapy. I fortunately come from a place, PGI Chandigarh, where in our training program, MD training, we have gone through a very structured and rigorous training in psychotherapy. If I was to just tell you this, enumerate, we had during our 3-year residency, 6 months, 1 semester teaching of psychodynamics, 1 lecture per week. Next 1 semester teaching of psychotherapies, 1 lecture per week for another semester, 2 semesters. And at the end of each semester, we had to pass an exam in the theory and practice. That's one. Second, we had a weekly psychotherapy case conference. Like we used to have clinical case conference for mental disorders, we used to have a psychotherapy case conference once a week, and that continued for 3 years. For 3 years of once a week psychotherapy case conference, where a resident, junior resident, who has seen a patient under the supervision of a consultant and is doing psychotherapy will present it to the department. And department here would be Dr. V.K. Verma. He was our psychotherapy teacher, and with the all the senior residents and junior residents sitting together. So a group of 20 people sitting together and a junior resident presenting a psychotherapy case, and which was discussed threadbare in the sense as to how the patient came, how did he say it, what was your first greeting, what was patient's response, and where did you keep your pen, and did you nod, did you grunt, did you say, how did you handle silence, how did you answer, and what did the patient say, and what. So we had to record the entire session verbatim, and we presented it verbatim, and this was discussed, analyzed, and Dr. Verma's primary inclination was psychodynamics. So we had a very good exposure to psychodynamic psychotherapy. Of course, other forms of psychotherapy like behavior therapy and basically that was also kind of discussed and talked about. And then all of us as junior residents, we had to do mandatory 100 hours of supervised psychotherapy. That was a requirement for becoming eligible to take the MD final exam. So we all had to kind of keep a record of which patient, how many sessions, which patient, how many sessions, and all the sessions record, and was signed by our supervisor and signed by head of the department, and 100 hours completed made us kind of eligible for exam. So this was the extent of training. So we were very much attuned and also sensitized to psychotherapy, and we will always in our clinical work required to make 2 diagnostic formulations. One was clinical diagnosis formulation and other was psychodynamic formulation for every patient. So having said that, I think it's important and it's great that we are now taking up the psychotherapy training at this level, PG, UG level, and also for junior faculty level. I have just a couple of suggestions out here. One thing that can be done is, what I hear from you and understand is that you plan to do online lectures every alternate week. Great. I would think that also incorporate clinical case conferences. Have the kind of a somebody present clinical case and discuss it with the consultant. So the consultant of the respective presenter can become the teacher also and mentor, or maybe others also. And then this can be discussed here, threadbare. I think that gives a very good amount of training, apart from doing didactic lectures, which you will do, I believe. That's it. And other thing is, I would say that make this a sustainable activity. Sustainable in the sense that as long as you people are there, you will do it. But then what after, you people, who are spearheading now, move out of this committee or move out of this, and then how will it go? So sustainability should be ensured. And for that, I would suggest that please record these lectures, all lectures, and make a repository of these lectures on the cloud, monetize them, make them available subsequently for generations, the students who can access it from the IPS can provide a platform, and we can have on the cloud these lectures, and this can be done. And other thing, over a period of time, maybe a first set of lectures can be delivered, will be in person, record them, and then subsequently let these lectures be played. The recorded lectures are played, and the consultant comes in the end for discussion and question answers and so on. So this becomes sustainable financially, and also takes the burden away from the consultants for having to kind of go on teaching time and again and repeating same things and all that. So that kind of a thing can be done. Another suggestion that I have is taking, and we also taking from what Dr. Gangadhar said, is the cultural adaptation of psychotherapy. See, psychotherapy given in the books that we also understood and learned is not directly as it is applicable. So we should come up with an Indian model of psychotherapy. A lot of our predecessors, our earlier teachers, Dr. Neki, Dr. Surya, and even Dr. Verma, they have written about, and Dr. Venkubarao, about the cultural, components to be incorporated in psychotherapy, which includes kind of quotes from Gita or from our epics and the stories, using examples, and so cultural adaptation, because it has to suit and also make an appeal to the Indian mind. Our Indian mindset is much more kind of receptive to our own, stories from our epics, from culture and Gita and so on. So that can be done, and then all the concepts can be drawn from there and put together. And I would suggest that you please prepare a kind sort of a curriculum for psychiatrists, PG and UG curriculum for psychiatrists in psychotherapy, and come out with a book. Prepare a book on psychotherapy in India, psychotherapy for India. Maybe psychotherapy for India or psychotherapy in India, based on Indian experience, Indian culture, Indian patients, Indian solutions. I think that's something which we should do. We do not have any book on psychotherapy in India for India. And the whole idea is to create a perpetual resource, to make a fundamental kind of a resource in terms of written material, lectures, and everything, and so on. So I highly appreciate the effort, and the book can have for PG and UG both. One book for PG and UG. For UG, the curriculum is different. For PGs, the curriculum is different. So I think prepare both psychotherapy curriculum for psychiatry, PG, UG, and a book. And then, of course, the lectures and deposit and the teaching. And this, I think, over a period of maybe 2-3 years, will become an excellent resource in the country. Thank you very much.
Thank you, ma'am. We will try to take all the suggestions and, try to incorporate all the valuable suggestions given by you, ma'am. We will try to do more and more case-based discussions, and we record this session, and we'll try to make it a sustainable activity. And the idea of Indianized psychotherapy use is quite wonderful. We try to definitely, with the help of UG and PG subcommittee, we try to come out with some of the records and the books. Thank you, ma'am. So we will move to the next guest of honor, that is the Professor Mohan Isaac, sir. Uh, I will invite Professor Mohan Isaac, sir, to share their ideas about the psychotherapy training.
Thank you very much, Ajay, Dr. Gangadhar, Dr. Pratima, all the distinguished office bearers of IPS, all the participants, and all the key organizers, Ajay, Kishor, Vinay, and all participating in this. I think this is, as all the previous speakers have said, it's an important program. It's a much needed program. I would like to just make a couple of points only. In many parts of the world, not just in India, in many parts of the world, including United States, psychotherapy is essentially dead. In fact, I'm quoting Melvin Sapshin, who was for more than nearly 25 years the main person of the American Psychiatric Association. And when he retired, he wrote a book, Changing American Psychiatry, a Personal Perspective. And the main thing that he has mentioned is American psychiatrists have essentially forgotten how to listen to their patients and how to talk to the patients. Of course, he was talking about how biology, biomedicine had taken over, psychopharmacology had taken over, how commercial interests had taken over. It is very well known, and I don't have to look for any kind of evidence. There are any number of papers which have talked about psychotherapy being essentially dead unless you give constant reinforcement for sustaining it. And what are the reinforcements? Of course, you have to reinforce psychotherapy to see that it doesn't atrophy. In fact, what is at danger now is not just psychotherapy, but even psychological mindedness of, forget about general doctors, psychological mindedness of even psychiatrists is on the wane for a variety of reasons, which are all obvious to everybody. And the only way this can be revived and improvised is by becoming aware of the training programs for our young psychiatrists. Savita has talked about it, Pratima has talked about it, how in some of the leading institutions where psychiatrists are trained, psychotherapy is an integral component of the training. There also, I suspect that the rigor and the seriousness, I could be wrong, but it's my fear that the rigor is declining even in these premier institutes. So, from all these perspectives, this platform, which has been initiated by Minds United and the ITOPS, etc., is very timely. It has to be supported. I heard Kishor say that there were more than 500 respondents when he did the Google survey, and it is an indication that a lot of youngsters who are undergoing training, who have heard about psychotherapy, but have not got any kind of training and had no chance of getting any training because nobody ever teaches them psychotherapy in their respective postgraduate training centers. This would become a platform. Kishore mentioned that you have already had 3 trial runs before you became bold enough to formally launch this. Mathew's kind contribution, you have established that it is possible. And I'm sure now with this formal launching by none other than the chairman of the National Medical Commission and with the involvement of the director of NIMHANS, I'm sure this platform will take off. It is, I understand, the full support of the Indian Psychiatric Society because I find the president, vice president, secretary, treasurer, editor, and the chairs of the respective education committees participating in it. So my best wishes, I think it has to go, all people who have time, all people who are teachers of psychiatry in different parts of the country and elsewhere, uh, who are interested in promoting psychotherapy globally as well as in India, should participate in this. I know that there are several people who would be interested if appropriately approached. The person I have in mind is Salman Akhtar, who is himself a product of the institute which Savita was talking about, who is written extensively about psychotherapy, and who has also talked about psychotherapy, the points which Dr. Gangadhar made. I would like to end by highlighting the point which both Gangadhar, Savita, Pratima and all made by quoting the first sentence of the famous paper by Dr. Jaswant Singh Neki, Psychotherapy, Past, Present and Future. Psychotherapy in India, Past, Present and Future, 1975, American Journal of Psychotherapy. I know the first sentence by heart because I read it when I was a DPM student. If psychotherapy can be defined as an interpersonal method of mitigating suffering, then various forms of psychotherapies have existed in India from past. Of course, they didn't have a clinical bias. This is the gist of what Gangadhar was saying. And as Savita said, many people have written about it. We need to elaborate on it. And thank you very much for asking me to participate and wish you all the best to Ajay, Kishor, and all the people who are pioneering and piloting this program. Back to you, Ajay.
Thank you, sir. And it's impossible to without your support. Now I will invite Professor T.S.S. Rao, Vice President, Indian Psychiatry Society, to share their ideas and views about the program. Unmute yourself, sir.
Good evening, and at the outset, let me thank you all for the opportunity what you have given for me to participate and share some ideas. I meet Kishore every day, and I'm almost always surprised because once in 3-4 months, he'll come out with one very innovative idea, and more than anything else, he has that capacity to involve quite a few people, and many programs I have seen last 3 to 4 years consistently doing a very good job. Coming to psychotherapy, I am from CMC Vella, where every week we had to present our case reviews, what actually we have done and all of that. And that, if we try to implement here, we are having such an amount of roadblocks, what I can say. Reasons are many, and even the students, one of the premier institute I was examined, one of the candidate was doing extremely well. When we asked her 1 or 2 questions about some of the psychotherapeutic techniques, she was fumbling. The explanation given was, sir, we are treating all the patients with the medicines and they are getting well. The next question was whether everybody is getting well. She has some question mark. Everybody is getting well the way actually they should get well. She had question mark. She could realize that how this particular psychotherapeutic techniques are useful for the individual. Even in our sexual medicine practice, I have seen a lot of people just writing some PDE5 inhibitors, and they believe that a bit of psychoeducation serves the purpose. In fact, I always say it is sexual problems, there are relationship problems. And the same story applies to many of the disorders. And from that angle, I'll not take much time, that this is an extremely important step. Psychotherapy has been emphasized even last year. In fact, I remember a psychotherapy related committee was doing a great job and developing a platform, going forward, sustaining it, giving a proper structure to this, and looking forward to a lot of productive issues coming out of this particular platform is something augurs very well. And my best wishes for each and every one of you who have taken this initiative and providing leadership in this area. Best wishes. Thank you.
Thank you, sir. Thank you for being with us. And next is Professor Mathew Varghese. And as we know that sir is already, taking some discussion case classes every month, which we are conducting. So I invite Professor Mathew Varghese to, share their experience and how we structure and take a step further.
Good evening, everybody. And it's really a big pleasure for me to see so many of you are here interested on this very important topic of psychotherapy. A very big thank you to the ITOP program, Kishor, Ajay, and all the people who are leading ITOP with Mohan's advice. I think the ITOP program is something which is very innovative and very new, and it's something that has come forward in the last few years to help with psychiatric training and psychiatric teachers. And I'm really humbled and thrilled that I've been asked to contribute to this program. My only qualification is that I've been a member and a coordinator of the psychotherapy training program at NIMHANS for more than 35 years. So as Savita mentioned, PGI Chandigarh was a place where there was psychotherapy even before NIMHANS, formalized psychotherapy training program, and we were very jealous in the 80s and when they had a program. And when Professor Shyam Sundar and Professor Raghuram started the program together with many other senior faculty in the Department of Psychiatry, we were quite thrilled. And I'm very happy to say that right from 1982 till the present time, very formal psychotherapy training program has existed at NIMHANS. So I believe that psychotherapy is integral to a psychiatrist. People come to psychiatrists to talk about their problems. And if a psychiatrist doesn't know how to talk to his patients, then he should be doing some other profession. I don't believe that psychiatrists are just prescribing doctors. Even the so-called hardcore biological psychiatrists, they're all talking to their patients. And that's the reason why people come. And they, in some form or the other, as Mohan said, they're all doing psychotherapy. It doesn't matter what type of psychotherapy that you're doing. So the whole program, as Pratima and Savita mentioned so clearly, the whole program is meant to discuss cases that people are seeing, not really focus on theoretical lectures. It's going to be practical the way we have planned it. It's going to be discussing basic tenets of psychotherapy, how to talk to your patients, basic aspects of supportive therapy, specialized therapies, whether it is dialectic behavior therapy or cognitive behavior therapy or any other therapy. I think people can learn after this, and if they're interested. But we aim to teach people the basic tenets of talking and communicating with our patients in terms of basic supportive work. And in the time that I've spent at NIMHANS, and also if I've listened to programs that have occurred in KMC Manipal and PGI Chandigarh, what psychotherapy the majority of us do is really supportive, psychoeducative, and basic nuts and bolts kind of therapy. And that's indeed what we intend to teach the students. I was quite overwhelmed that in the first 3 sessions that we had, we have anything from 50 to 80 students who are there on the Zoom platform. And I was actually quite worried as to how I will reach out to all of them and discuss aspects of psychotherapy. It's a huge group. So what Savita said is very important in terms of sustainability. I am going to ask ITOP, and I myself will ask various other faculty who are interested in this area to come forward and do some sessions. I guess it leaves it out for me also, because if I have to commit, I have committed 2 weeks, 2 days in a month, but I'm sure there'll be times when I'm not there and somebody else has to take on. So I think Mohan's comment of asking Salman Akhtar and other people is a great idea, and we're going to ask many people, Raghuram, maybe Shyam Sundar, other people who can sit in on these sessions. And we really need to, and we really hope to enlarge it and make the program really sustainable. Like, this whole question of what happens after we are not there is a good, very, very good point. One of the things that, as Pratima said, psychotherapy is science and the art. And essentially, I think what in the time and age that people are talking about ethics and doing harm in therapy and so on, I think the main tenet of what we have to teach our students is basically how we should talk and communicate and interact with the patients and do no harm above everything else. And I think these are some of these ethical, cultural principles that are very specific to the Indian context is something that we hope to teach and instill in the students who take part in this psychotherapy training program. So I understand that ITOP has enlarged the program and said that this program is open to both consultants and students. And I was just mentioning to Kishor just a few days ago that we probably need to have a different forum for consultants and other people who have passed on in their training, because that's a different forum, I believe. And the students would need a different forum where students can openly and easily discuss their cases without any kind of apprehensions and any kind of feelings of that some consultants is sitting on these sessions and they can't say anything. So I think it's important. And about 5 years ago, Arun, Kishor and I, during COVID, we started online balance groups. And I think that a forum for consultants and other people doing therapy would be balance groups that we have started in the last 5 years. And Kishor and I are very happy. Arun, Kishor and I are very happy, and we were slowly enlarging these balance groups. And we've had these discussion groups going on every 2-3 weeks, every month in the last 5 years. So I would encourage many consultants to join these balance groups. We have sent WhatsApp messages out and asked people to join in the balance groups if they want to. I think that's the way we should go with regard to consultants and seniors who are interested in this program. So as I mentioned, thank you very much to all of you. Thank you very much to the IPS for this massive support. Thank you very much to Gangadhar and Pratima for being here. That says a lot about the background, backing and the support that is from the NMC and from NIMHANS. I am committed to this program, and I will, as I told Kishor and Ajay, I am with them fully, because I believe that therapy, whether it's individual therapy, family therapy, or group therapy, is something that is part and parcel of our profession. Thank you very much, and good evening to all of you.
Thank you, sir. Thank you for your kind words, sir. We have little shortage of time, so we will quickly move to the Dr. Amrit Pattojoshi, Honorable General Secretary, Indian Psychiatry Society. Sir, would you like to share few ideas?
Thank you so much. I will not share much ideas because the experts, the best in the business, have already spoken. But I would like to just share one thing. I and Aleem had started an initiative with the Odisha Psychiatric Society, the Thursday Musings. It's based on psychotherapy. We have a rich, library of recorded videos of all aspects of psychotherapy, and we are still building on that. I think it has more than 234 episodes. More than 200 has been based solely on psychotherapy, different models, different ways. We have taken faculties throughout the world. Mohan sir will tell. A lot of people have come repeatedly, and I think we have made a good beginning. And we can. The IPS is always ready to collaborate, work on this. Be it NIMHANS, be it NMC. We are wholeheartedly with you in this initiative. I would congratulate you, and I give you all the support from the IPS as secretary. Thank you so much.
Thank you, sir. Thank you very much. Now I would like to invite Dr. Sujit Sarkhel, editor, Indian Journal of Psychiatry. Sir, please share some views about this platform, sir. Dr. Sujit Sarkhel, sir, please. If Dr. Sujit Sarkhel may be having problem for this connection problem, I will call him later. Dr. Aleem Siddiqui, Honorable Treasurer, Indian Journal of Psychiatry. Sir, please share your views about the psychotherapy training and about this platform.
Thank you, sir. Thank you so much for inviting me. My pleasure to be here. My respect and regard to the dignitaries. Gangadhar sir is there. Pratima Murthy ma'am has just left. Mathew sir is there, Mohan sir, yourself, Dr. Kishor, Vijay. So everyone who is working on this platform, my congratulations to you. As Amrit said, so we have a quite a database ready already with Thursday Musing, so we can collaborate on that. Now the thing is regarding therapy, uh, what is psychotherapy is usually being considered by the clinical psychology portion. So even if we are not experts in psychotherapy, it is not our core bread and butter. So we have to tell the students that if you are trained in some sort of psychotherapy, now your data collection becomes a good history taking. So when you're starting to talk to the patient, instead of collecting data, you are able to collect a good history, which will lead you have a better mental status examinations. Because you must have observed, if you discuss motivation enhancement therapy, I mean the substance case comes, though, so the history, MSc, all this is slightly oriented, slightly better formulated. So case formulations become better. So even if you are not doing therapy, proper core therapy, your workup, your case formulation, your rapport becomes better. So that is the importance of therapy. Now, few suggestions is uh, maybe a bit far-fetched. If we can make therapies a bit time limited, the thing is 1 hour session, 45-minute session, people may not have that much of time. So many times it is possible to make it crisp, make it shorter. So shorter versions of therapy, if you are going along with this program, if you're able to find shorter versions of therapy, that will have more acceptance, and one person will be able to deliver more sessions. Suppose 1 hour sessions, instead of that, if we have 15-minute sessions, one resource person, one person who is trained in therapy can cater to 4 people in that time. We have dearth of psychotherapists and psychotherapy delivery system. So that is one thing. Now, another thing, if you can keep in mind how to do machine learning train GPTs, because this therapy portion is the technology people are very well jumping into it and taking away this portion. So if we as IPS, as ITOPS, as all the psychiatrists, mental health professional are able to combine somewhere and train a GPT and may launch our own chatbot or genie or something, that would be very good. So that is one thing. And one just parting comment, uh, uh, what I many times hears is psych difference schism between therapy and biological. So what I think is psychotherapy is purely biological, medications are biological, so there is no schism between doing therapy, being biologically oriented. So I think that is one thing we have to take care of. So anything that changes us, changes our brain, is biological at different levels. So if you are able to integrate that, if you are able to tell people you are changing the functioning of brain, it is a biological thing. So many of the khistan that is going on would stop, and acceptance of therapy would also increase. So that is all from my side. Thank you. Back to you, sir.
Thank you, sir. It's a nice suggestion that AI technology has to be, incorporated in the therapy. And we will also doing some kind of experiment with AI. We will discuss this later. Now we will invite again Dr. Sujit Sarkhel, sir, editor IJP. Sir, would you like to share some ideas?
Yeah, thank you, Dr. Ajay, and my sincere apologies for being late. Actually, I have been told that this platform has already started working, and I think you have already enrolled many people. In fact, I personally have asked some of my senior residents and faculties to join in because they have expressed a lot of interest. And I feel that there has been a strong demand from faculties and residents in psychiatry across the country for training in psychotherapy. And I think this PG and UG Education Committee led by Dr. Kishor, you and other Dr. Piyaranjan, I think you are doing a good initiative. And probably to begin with, it's going to be online, and subsequently there should be, I think, a few contact sessions also. So I hope that this will fill a long void that is there in terms of therapy training of our psychiatry professionals. And I wish this venture all the best. And I will personally try to enlist some of the people known to me so that it increases the workforce and also helps in training the professionals accordingly. I wish you all the best once again. Thank you.
Thank you, sir. Thank you, sir. That is true that we have started some few registration, and we have 500 registration till now, and an increasing 300 of them are psychiatry resident. Okay, so now is the turn of the chairman of the UG's education subcommittee, that is Dr. Avinash Priyaranjan. So I would like to invite Dr. Avinash to say some words.
You're muted. You're muted, Dr. Avinash.
Yeah. Sorry. Yeah. Am I audible now?
Yeah.
Yeah. So thank you, Dr. Ajay, and thank you, Dr. Kishor, sir, for inviting me to this webinar. As a chairperson of the UG subcommittee, I'll restrict my suggestions or understanding of psychotherapy to undergraduate students only. We all know that as per currently, the undergraduate training throughout the country is competency-based medical education. And different university may have some differences, but in our university, we have some STL, like self-directed learning, where we are focusing a lot on psychotherapy. So I think if we can incorporate SDLs, because SDLs are very interactive, they're also self-directed. So only the day before I took one SDL on cognitive behavior therapy, and I found the kind of interaction and the enthusiasm that the students had was much better than any dialectical lecture that I used to take for undergraduate MBA students. So that is one thing. Second thing is that I feel if we can incorporate electives, like we all have electives now for undergraduate students, and for electives, if psychotherapy, brief psychotherapy, or some form of psychotherapy can be part of the elective, then that is also where we can train our undergraduate students. Undergraduate students, irrespective whether they eventually become psychiatrist or any other specialist, some skill of psychotherapy or some form of psychotherapy will be needed if they are actually dealing with patients, right? So I believe psychotherapy is not something that is restricted only for psychiatrists. It's done by all clinical practitioners, irrespective of what specialty they are eventually engaging into. Basic listening skills, empathy, basic counseling skills, motivation interviewing, some form of relaxation therapy, some form of behavioral therapy, even a cardiologist also does. All of us do some kind of therapy without even knowing that we are actually doing some kind of psychotherapy. So I believe psychotherapy has to be an integral part of undergraduate education. And if we can tomorrow, like in most of the colleges, undergraduate colleges, there is no separate paper for psychiatry. As a chairperson of the undergraduate subcommittee of IPS, this is one of the tasks that was given to us, that to kind of create a kind of discussion around this, that can we have a separate psychiatry paper for undergraduate students. In most of the universities, as we know, that the psychiatry is not yet a separate paper. So in undergraduate, unless there is a separate paper, students do not give that much of importance to that subject as they would otherwise. So these are some of the things I think if we can integrate some basic psychotherapy, some supportive psychotherapy, some motivational therapy, and some form of CBT, because CBT is something that is practiced in different forms across disorders in psychiatry as well as other disorders also. That's my understanding, and I would like to learn actually attending this kind of psychotherapy workshops by the IPS. I would like to learn myself that how I can pass on this in for my undergraduate students, and also how we can integrate into undergraduate education working as a chairperson of IPS. So thank you very much.
Thank you, sir. Now I'll hand over mic to Dr. Kishor M so that he can conclude the session.
Thank you all. It's perfect 8 o'clock now, and we are just past 8 minutes. And to begin a session at 7 o'clock and close at 8 o'clock with all dignitaries from Dr. B.N. Gangadhar, Chairperson of the National Medical Commission, to Professor Mohan Isaac, sir, from Australia, all office bearers, and the UG and PG committee members and all people who are interested, including the director of NIMHANS, Pratima Murthy. I think it goes a long way that this program has been very successful in terms of launching of this particular aspect. However, our sustainability and continuity is based on the keen interest and support extended by all of you. With this, I wholeheartedly thank each one of you for your valuable time and deep insight you have given. We will do our best, and please remember that this is the program and platform which involves all of you. So your active participation is something we expect. With this, I close the session. In the same platform, our PG committee members will continue discussion. So thank you one and all. Thank you, everyone.
Thank you. Thank you very much.